Hello, everyone. Hope all is okay with you. This is Atria Simon. Thank you so much for watching this channel, and I'm really appreciative, and will still always be appreciative for watching this channel. Uh, Thank you all. Thank you so much. Today we are going to talk about the basic knowledge of HMIS, data management, so-called health information system, where we are basically going to look at just the basic understanding of HMIS. These are my details, as you see them down here. I don't need to go through it. Everyone is able to, see it. A lot of scholars have written about HMIS, its definitions. So basically, my session here, it's all about, it's not going to be uh, like quoting anyone or someone, but what I'm going to do is the practical bit, the applicability. So I'm going to generate my own definition in relation to this. So the target group for this, of course, we have very many people we are targeting. We have data clerks, data officers, records assistants, biostats, all the M&E fraternity, health workers, since it's mostly attributed to health management, information system management. Without wasting time, HMIS in my context, I looked at it as a platform used by Ministry of Health to monitor healthcare activities within the country. It may not be basically Uganda or any other part of the country. I'm going to break down what the platform means. What do I mean by a platform in this context? Now, a platform is a system enabling processes, just in processes, interaction, or data exchange. Meanwhile, the term monitor, what does it mean? To observe, track, assess progress or performance systematically. Then, of course, when we talk of activities, basically we're looking at the task or action aimed to achieve a specific health objective. So, based on these three key terms, that's how I came up with this definition. Uh, an example to the healthcare activities that are monitored by HMIS. We looked at disease surveillance and control. We look at maternal and child health services. We look at family planning and reproductive health, HIV and STIs, malaria prevention and control, NCDs, nutrition, so many, including health facility utilization, drugs, supplies, so many activities we use HMIS for, and it's the platform MOH uses to monitor and to make decisions regarding health in this country. But now, why is HMIS? One of the goals of HMIS is to provide quality data to support evidence-based decision making at all levels of health service delivery. Maybe in this country or outside the country, the best I know is we all use HMIS. Then the purpose, basically, designed to assist the managers in decision making, of course, through the evidence-based practices. What are the attributes of HMIS? We look at the relevance. Is it aligned with the government policy and the health goals? Yes, it is. Functionality, of course, the data used to inform decisions. Why to inform decisions? Basically, to improve public health systems. Of course, integration is one of the attributes, set of forms to collect administrative data, preventing duplications. The last one, basically, we are going to look at the routine. That's why we are going to look at the period that are collected regularly, the nationwide. HMIS documentation, we do have HMIS manuals. One of them is for data collection and aggregation manual, SOP 2020. Currently, we are still using 2023. We have indicator booklets that provide detailed definitions, methods, and the guidelines for interpreting indicators. We have all these manuals. Then we have reporting guidelines and the training manuals, which are all there to support, of course, to make sure we supports efficiency and the accuracy. When you look at the overview of HMIS tools, why? The purpose. These tools are basically to facilitate the structured collection, entry, storage, analysis, and reporting of health data. We have got two types basically currently. We have paper-based, those are the registers, tally sheets, and forms. Then we also have electronics, whereby we have the DHIS tools, OpenMRS, the one we have customized in Uganda as Uganda EMR. So we have so many systems across, electronic systems we use for managing data at facility level. Clinic Master and EFIA, they are for now official tools we're using in Uganda. I don't know what it's outside Uganda since I've not been there. When we look at the classification of these tools, here I'm going to request we pay attention because it's from this level is when now we are getting into the actuals. We have pre-primary tools for data collection. These are data collection forms, initial health facility services. Now, this pre-primary tool, basically, it's an interaction between a health worker and a sick person that is basically referring to a patient. So this data is go through the interaction. For example, medical form 5. Medical form 5, it's a pre-primary tool, and it's the form we use for demographics and then the history of basically clocking a patient at the initial stage. Now, from a pre-primary tool, it takes us to primary tools. Primary tools, these are the source documents in the country, call them source documents, such as registers. Basically, registers whereby the first example of pre-primary tool after successful work on these patients. Later on, this data is supposed to be transcribed into the OPD register. That is now that's the primary source document, the primary tool. Then we have a secondary tool. Those are the reporting templates, basically, those forms for summarizing and reporting data. However, the tool 1 and 2, primary and primary, currently has one of the strategies to improve efficiency and to minimize the workload. The ministry has rolled out systems in place. This country, I think basically we are for now using two, that is the clinic masters and EFIA, that will be rolled out across the country with time to reduce the paper burden and the patient delay time. So those two, as per now, they're going concurrent, and I believe with time they'll still be concurrent till when we streamline the things with time. After understanding these tools, what's next? When you look at the pre-primary tools, just the way I explained in the previous section, it contains basically the contact information, identity, location, and patient details. Primary, basically, we record also the same on daily basis for evaluating, of course, the healthcare performance. Secondary, of course, the reporting, I've told you, the reporting forms, summaries, and the rest. Then we have management data. Basically, we use this was now to evaluate and to make decisions. Under these categories of HMIS data collection tools, we have got some examples here, just the way I mentioned it earlier. We have medical form 5, lab request, treatment sheets, a lot of forms, including HIV care card, TB, referral notes. All these are primary tools. Primary, the registers are here. That is outpatient register, inpatient, antenatal, lab, very many registers that falls under this. Now, secondary, we have reporting forms, For notification, we use HMIS 033B. That's weekly surveillance report, HMIS 105. That's for reporting outpatient data. We have nutrition addendum. We also have quarterly HMIS 106, basically that looks at HIV and TB. Then you also have annual reports. Under management, of course, we look at the record of the management meetings, records of support supervision, tools for HMI support supervision, inventory tools, so many. So basically, these are the categories with their own examples. Now, I want to chip us briefly about the flow of these tools. Primary tools, reporting templates, frequency. The main reason why I'm emphasizing, when you realize that there are like 3 slides speaking about this same, the main emphasis there is often the team that is the foot soldiers. They do not get a lot of course, I understand we do not have much time at times for our subordinates because we also have a lot on the table. So it's the reason why I actually decided to come up with these videos to make sure you can watch it at your own time. If you don't understand these flows very well, you can easily mess up at the end. So you need to know which one fits you, and up to the end. So the first flow is now in terms of example, when you look at the OPD, primary source document, the official tool is called the medical form 5. That's the one we use for clerking patients at the OPD. This medical form 5 enters into OPD register. From OPD register, it goes into 105. That is the reporting tools. That's the secondary. Then the frequency for reporting, this is on monthly basis. So outpatient 105 is a monthly reporting tool. Then we have inpatient. We also have inpatient admission forms. We go to inpatient register, and then the reporting template or the tool is called HMS 108. That is for inpatient. Then it's on a monthly basis. We also have HIV care card. Most of people know those ones who have been to the project world. HIV care card, the blue card, most people call it a blue card in this country, but its official name is HIV care card. Its primary source document is, of course, art register, but at least USID with the support, Ministry of Health with support from USID. Most facilities are implementing Uganda EMR, the one formerly known as OpenMRS. At least I'm sure the coverage is okay countrywide. Is the one we use for managing HIV data, and this is reporting on quarterly basis. Then we have TB. TB, that's NTLP basically. TB client cards fits into health unit TB register, and then we also have 106. That's and it's reported quarterly. In that brief, the conclusion I would give you is HMI is a vital tool for monitoring and improving healthcare system or delivery in the country and even the entire world, and it ensures data-driven decision making for the better healthcare services and outcome. Our day two, the area to cover. After knowing all those definitions, the flow of HMIS tools, we are now going to the step 2, where we're going to look at the definitions of those key terms. That is what the data is, what's the data set, what is data element, what's an indicator, what are the example. Now, how do you compile these reports? And basically, I'm going to ask you, whoever's watching it, do self-assessment especially those ones who are students. And even in another area where you're practicing this, I'm going to implore you to, do some self-assessment based on the video you've watched. Then you give me a feedback. How is it? Then, of course, I'll be able to support. My telephone contacts are there. My email address is there. So I'll be able to support. So now in the area 2, day 2, basically, we are going to deal with that. Still, I have to bring for you the routine reports and the timeline. Why did I bring this here? Just to refresh your mind. You need to know that the routine reports we collect under health management information systems. One is weekly surveillance. We look at what is happening within the surrounding on weekly basis. For example, even Ebola that has been of recent, cholera, an outbreak that happens. We on every month of the every Monday we report on this data. What happened? So this data informs the stakeholders. For example, if there's an outbreak of malaria, especially in eastern region, this data will be able to tell you, and within no minutes, find surveillance team will come on ground. So that's why the weekly reporting is there to do the surveillance on weekly basis. Then we have HMIS monthly reports. That's 105, 108. Currently, I've seen the VHT 097 has been brought on monthly basis. That's something new. Now, the timeline for reporting this is 7th of every next month. Whether you're doing quarterly reports, you're doing monthly reports, you're doing annual, deadlines remain the same. 7th of the next month. So, it's a quarterly report. Just the way I told you, quarterly report covers 2 areas. That is the HIV and TB. Annual report. Previously, I've also seen it here. It's the same. That's 107. Let's get to the definition of the key terms used commonly. And I'm going to implore people to keep a lot of attention here. We often misuse these words a lot. Data, we all know, these are raw facts, all figures, of course, collected for analysis and decision making. One of the examples of data is number of patients attending OPD. That's just a data, a raw. It's raw. There's nothing into it, so that's just raw like that. Blood pressure readings, weight of a newborn baby, number of malaria cases. These are raw data. So that's data by its definition and example. Now, dataset. What is a dataset? A dataset is a collection of related data items grouped. Keyword is grouped together and collection. For example, a monthly report, of malaria cases in a district is a dataset. Annual immunization records of children under 5, hospitals daily admissions and discharge records. So that is a dataset. Now, what's the data element? The smallest unit of data that holds what? Meaning. Number of malaria cases in January. Total number of children vaccinated. Average sugar level. So, even the number of maternal deaths reported in the districts. So, these are just basically few data elements, examples of data elements. Now, when you come to an indicator is a measurable values used to assess progress or performance. Now, when you look at measurable values, you just know these ones are basically we're talking about three things: percentages, proportions. Basically, that's where we are speaking from. Now, what are these? What are the examples? Though indicator, mostly in this field, many people knows indicator. What disturbs people are the data elements and the data sets. But indicators, of course, percentage of pregnant women attending first ANC, the first trimester, teenage pregnancy rate. So these are calculated values. For example, if you are looking at teenage pregnancy rate, because our example is going to be based on that, since that is one of the issues that is affecting us from the eastern part of Uganda. And look at teenage pregnancy rate as one of the indicator we're going to follow. Basically, after you understanding what a data is, what is a data set, what is a data element, what is an indicator, I've just chipped in the process of collecting, compiling these reports. When you look at outpatient 105, there are key sections. I'm not going to talk much about it, but if you need like me to take you through process by process, I believe you'll get in touch with me. We do some video calls, then I take you process by process. But here I'm just giving you key terms, like key sections. Under 105, when you're compiling that report, what do we look at? Basically, OPD attendance, diagnosis, ANC, maternity. These are the key sections we look at in that report. Then the data that is required, basically we look at sex, ages, disease cases, referral, treatment, and etc. etc. Because just the way I told you, HMIS, those reporting forms look at aggregated figures. We deal with aggregated, not patient level surveys. That's a different modality to deal with mechanism. So this is of course monthly. Inpatient, look at admission, discharges, deaths, and still we use still the same. Age and sex is the key that for now what we are using, the metrics we are using, and this is on monthly. Now when you come to art, still age and sex. So when you look at these three reports, you'll find that age and sex are the key. But mostly our data for now, disaggregated one, they are based on this. When you look at day three, now in day three, basically, we're going to look at DHS2, data entry, data extraction, download, simple Excel, about how to organize data, data sets, then maybe some simple analysis, some dashboard at the end of the video. Just the way to take you through one of the key software we are using, that is the DHIS2, that is the District Health Information Systems. DHIS2 is now the slogan we're using, but it is DHIS. This is just put there basically for people to understand what is this. So someone would say, what's the difference between DHIS and DHIS2? These are versions, they are developments in this version. So when you look at DHIS overview, it's a web-based application we use for collecting, validating, analyzing, and present of aggregated statistical data, of course, tailored to integrated health information management activities, just the word mentioned earlier. It is generic in nature. The contents can be customized without much programming. It's, of course, developed by Health Information System Program, that's the HISP. Of course, it's an open source. That's why you find people, the designated people who have the rights under DHI they're able to customize it to our country. It's a system that's used worldwide, but you can customize it based on your needs. DHS2 implementation in Uganda, of course, with the support from implementing partners, MOH, that's the division of health information rolled out DHS2 at all this level. You're able to see here how it is accessed. Of course, it's on a standard web browsers. We all know it is. That's how it is accessed. But the key disclaimer here is this is a system that requires authentication. You're not going to access it just like that, but the demos are there. You can go to online and try to get in touch with the demos. And DHIS2 itself has a platform for training. So if someone wants to get much into DHIS2, to understand and get certificates. DHIS2 are going to refer you to the DHIS2 platform where you can be able to log in, access, and you get a certificate, you get a thorough trainings. But from this level here, majority of the audience I'm communicating to, these are people who already have access to these systems. Where I'm just trying to address the issues of just challenge gaps. There are few gaps that we needed to iron out about it. So you need to have passwords and username to gain access to these systems. And the standard operating procedures, for them, they are there. Anyone can access them, but access to this system is limited. We all know the authentication issues. These are very sensitive data for Ministry of Health to protect. So you need to be authorized to access it. How do you navigate it? Of course, DHIS2 has too many menu. That is the app menu and then the profile menu, just the way you're seeing it up here. This one, you can read them. This is how its login page is, where you'll be able to access the system. That's why I told you it's something that's a bit authenticated. You just don't enter into it. So you'll have to, get access. Normally, I see it is the biostats who are the official owners of the districts. So they're the official managers of data. So they are normally the one who have access to this. And then plus other stakeholders that are relevant and validated to have it under the instruction of MOH guideline and the Department of DHI. These are some of the features that in DHIS2. I'm just going to give you summaries of DHIS2. These are the features of the apps. We have very many event reports, event visualizer, data entry, tracker capture, dashboard, a cache, cleaner, then you capture, data quality, visualizer. But for a startup, for the benefit of this video, let me not go too far. Let's pick the basic three. We are going to look at data entry app. That is basically for data entry 105, 106, 108, all the entries for those it's done under that. However, 033B, we have it's collected through an app, a mobile app that is done at a bit facility level. However, still here you can be able to enter, but the practice is not it's not a practice to enter 033B surveillance directly from here unless there are system challenges, maybe network issues where you cannot be able to submit weekly reports using mTrack. mTrack is the app. It's a web-based app we used for submitting weekly reports using SMS, something that is very easy and simple to do at facility level. Capture app, I've brought this capture app because we face a lot of challenges, especially with those mortality entries into the system. So the teams that whoever is watching this, please spread it around that for the teams that have never entered or who are struggling to enter MPDCR data into the system, just know that we use capture. That's where when you click on it, even the entry form, the only thing here is just click on it, then you follow the prompt, you'll be able to do the entry. Then event reporting app, it's the one we use for extracting data of the MPDSR. For analysis, patient level. Event reports is for patient level data. Give you the details. That's when you're able to, for example, extract, if you want to look at the causes of maternal mortality in the region, you'll have to go to event reports. You get the data elements. You extract everything one by one. You take to Excel. That's when you'll be able to come up with how many clients were audited, how many are missing, what's the region what was the reason for the mortality, how long have they spent, where were they referred from, what was the condition before the referral, after the referral, what transpired along the way, what's the management, for you to come up with the such concrete data analysis. You need to use event reports. Uh, Meanwhile, when you look at the data visualizer, uh, we data visualizer basically data visualizer we use it for extracting our data. For example, if I want to extract data, let me say I'm looking at the teenage pregnancy in Busoga region. This data, there's a data from UFIA, Uganda National Population. We already have it there. Those surveys are there, but we know the surveys happen like after every 5 years. So when you need something current to understand the trends, the current problem you want to address, you'll have to go to data visualizer. You get the necessary metrics. You will be able to download that using data visualizer. And there's a section where we're going specifically when we are going to reach that section of data analysis as an independent. I'm going to create a new video for data analysis specifically after you understanding all these basics. That's when you will understand how we actually deep dive, go deeper into it. So this is just basically the entry screen for entering the reports. You can see that this is the outpatient 105. You just enter the figures after collecting your data from the HMIS forms. You come and organize it and then enter it here. Then after here, that's when we use this data from the data visualizer app. Especially when you want to look at maybe OPD utilization rate, that's where you go and get this OPD attendance from. You get the aggregated figures. This is the data visualizer app I was talking about. You will see the under data visualizer app, we have main dimensions where you look at the data itself. Under data, where the series is under data, you'll find the data elements and indicators. So you go and specify based on the way how you have understood it outside there. So it basically looks at the data elements, the data sets, indicators, everything you need is inside here for you to understand. Then the periods, the organization units, they're just simplified for you. Just after watching this video, you'll be able to, have something authentic. Now, this is a data visualizer app. What it does, extraction, downloads, and the rest. So when you look at the previous one, I was telling you what it does. So since this is for the first time, I was able to get there and you can see what this is able to display for us here already. For example, I mentioned earlier was like teenage pregnancy. Today our issue here is we want to appreciate the teenage pregnancy. How is it doing in this region? So I decided to pull out this. This one will be able to tell us what is happening around. However, the details of teenage pregnancy, we shall have to triangulate some few sources, especially when we reach that section. But here, when you look at this data in a brief, now you have pulled it out. From here, you just go to the download app. You'll be able to download it into Excel. Now, when you reach there are two things. There's Excel and CSV. I believe you know the difference between the two. In case you do not know, CSV, that's basically comma. Now, the difference between the comma separator, the difference between an Excel format and the comma is that for CSV, it gives you whatever you need in the format you deserve. But there are some data elements when you are dealing with the big data extractions. you'll find you're going to have issues. The Excel is going to start freezing for you. In brief, which I'll talk much about this when we reach on the Excel part, when we are going to be doing the section of organizing data, analyzing, pivoting. You are going to understand why we need to use CSV instead of Excel. But for simple extractions like these ones, you can use Excel. It's not bad. It's okay. Excel format. Uh-huh. After understanding all that, and you have extracted your data very well into the Excel, very well using CSV format, I'm going to briefly introduce you to the data analysis. Basic, what are the key basics to consider before you do data analysis? One of the things you need to do is to understand the importance and the applications, the types of the data you need to have, because we have two, qualitative and quantitative. Now, quantitative is statistical. Qualitative is non-statistical. Then two, we're going to look at data collection and management, where you need to understand sources of data. So now, if I'm sure you're now trying to, reflect back when I was talking about sources of data. Now you now understand that you'll be able to tell that how important is it? Why do you need to understand the sources of this data? So this is the time. It's coming out in data collection. It means you should have understood it. Two, we have data cleaning and validation techniques. Now, when we look at data cleaning, basically this is a data cleaning and validation. They are basically the same. We are looking at the process of validating this data. For example, we have data cleaning exercises that happens on monthly and quarterly basis. There are so many error transcription. Error can be transcribed from a data entry section, that is from HMS 105 to the system, DHH2, that's an entry error. Two is even a transcription error where you are transferring this data from the tally sheet to HMS 105. Instead of entering maybe 100, you find yourself you have entered 1000. So that's the importance why the data cleanings, they are very okay. You need to consider here. When you see abnormalities, especially after extracting your data, for example, you will say maternal dates. You see over 1000 maternal dates in 1 month. Definitely, as someone who is in this field, you ask yourself immediately, is it possible to have 1000 maternal dates? Immediately, you need to validate this data. After validating it, you need to clean it in the system. Basically, that is why it's important to have data cleaning and validation. Statistical concepts and tools. Here, we are using of course, descriptive. We are looking at descriptive statistics where you look at the mean, median, and mode. We also have inferential statistics where we look at hypothesis testing, then regression analysis. Mostly, those two are used in research environment to communicate findings, basically to analyze findings. They may not be so much importance, but this, I'm just giving you the general analysis perspectives, what you need to know. But in this context, that one may not be an issue. And three, I would say you look at number three, the software. Basically, Excel. We have so many softwares. They are not only this, so many. But of course, Excel has been the key one. We've been using Excel for this, of course, the analysis, simple analysis we do. By the way, for the sake, you can also design dashboards using Excel, but at lower level, that's basically, I think, facility, maybe at one district. But when you reach the level of managing 3 districts, actually a cluster or a region, a country, you will need to use other softwares to manage the data sets. Maybe software, Power BI, we now use Power BI, which is very okay and it works well, and so on. That one there, it's another topic. Number four, there's data visualization. Basically, of course, you need to consider that when you're doing analysis. Which visuals am I going to use? Am I using charts, graph? And if you say you're using these charts, is it a bar graph, pie chart, a map? It depends on what you want to pull out and the audience that you're going to communicate to at hand. Then interpretation and reporting. My dear, this is very key. Often we do a lot of analysis, we do all very sort of things, but one thing we need to know is you need to know how to interpret your data first before anyone comes into the picture. Why am I saying this? When you're doing analysis, you should ask yourself like at least 5 questions. The one you're anticipating people to ask you. When you ask yourself and you are able to answer them in your slides, just know your presentation is good. But if you cannot answer 5, you can't question yourself, trust me, by the time when you reach the audience, if someone has not critiqued your work, you are most likely to have issues. Because the audience you are going to meet, you don't know them. Okay, you may know them, but their capacities, you may find yourself dealing with technical directors, specialists, people who have seen it all. So your content that you're going to bring out matters. So you need to interpret your data very well before you go into the presentation modes or any other things. Of course, we have ethical considerations, data privacy and security. We have those laws around. Of course, also ethical use of data. Do not misuse data. Eh? That's one thing we need to know. Data in the current world, data is a very key. So when you start to tell people that we have confirmed the 50 Ebola cases in Busoga region, the moment the media hears that, you do not confirm it. For you just there we have 50 cases, the population will go into panic. That is a misuse of data. You deserve to be arrested. So let's use data properly. My colleagues who are in this fraternity. Why am I bringing this data visualization reporting here and interpretation? I want us to look at something brief, that is the teenage pregnancy I was talking about earlier. That's the data we extracted from the other slide here. The disclaimer here is this is not an actual data. This is a demo. We're just using it for this region. Since I'm someone from this region, I'm just using it. It's a demo. That's a disclaimer. It's not an actual data. But I'm using this for the purpose of learning and for the purpose of training. Because these such kind of trainings, we normally do not have them often. So I'm just trying to reach out to my fellow colleagues who are in this field to start thinking outside the box. Here, what did they look at? This is the teenage pregnancy. There are two ways of calculating teenage pregnancy in this context. One is you are going to look at the population data. Two is you are actually looking at the actual number of mothers who are attending antenatal. One, ANC1 attendance out of all the age groups. Because when you look at our age group for the country, we have below teenagers are below 20, that is 10 to 19. Then we have also that specific age group 20 to 24. These are also our young girls and young mothers. Then we believe from 25, you okay, you can do that. But why am I addressing these teenage pregnancy issues? It's not that I just feel I need to have this. It should be the first example. It can prompt you to think better and look. We have all read what happens within the country. We all know that there's a lot of teenage pregnancy in Busoga region. So now, I'm not using the actual data, but you can follow this example of mine to use actual data to tell you what is happening. You can use this data to help the community and you save some young mothers. So when you look at this data here, I looked at the I went with actual number of antenatal mothers, ANC1. These are just examples, they're not actual figures. So for example, we have ANC1 mothers here. Out of these ANC1 mothers, we also have these 10 to 19 young mothers who are attending antenatal. When you look at all this denominator TPR, this is our whatever, basically, it's the denominator I'm talking about. That's the population of these districts. Also, all these things are demos. So now when you look at this, when you look at teens pregnancy rate versus teen pregnancy rate per catchment population, I was just trying to compare the two sources. When I say actual versus the population, now this population here, they are online. I was just trying to see something close to that, something close. So when you look at these two, you find that this data is pointing at some district. Now, one thing we need to understand is when you want to help programming, you do not leave data along the way. For example, now that we have identified here, Namaingo has high teenage pregnancy rate. We all know the cutoff point for teenage pregnancy rate for the country. They are here, put them down here. You have seen the cutoff. This is it. Namaingo. So now that it's Namaingo, what next? Now that's when you find that you will have to get in the knowledge of M&E coming in. Programming comes in. Do I need to leave this data at this level? If I leave it here, what will it bring? Okay, so what? What have you done? Nothing. Two, now that it has pointed for you, Namaigo, go deeper. What are the sub-counties in Namaigo that are contributing to this? Get the sub-county level data. Go to sub-county. Now, when you look at the sub-counties of Namaingo, these are the sub-counties. I went deeper to understand which sub-county. Now, you can see, we will say Namaingo, teenage pregnancy. Not all sub-counties in Namaingo actually doing bad. There are others that are okay, others have high rate. So now when you look at this, you go and apply this. This is conditional formatting, just some simple formatting to understand, to give us the color codes. These reds you see, they are not basically just coming from nowhere. This is a conditional format telling you, Excel telling you, there is a problem there. We all know red. When something is red, definitely you know something needs to be done. So here it is telling us that there is a sub-county called Banda that is having what? A problem. That's where the highest teenagers are. Pregnancy is. Now, if you say it is a Banda, and someone wants to come from maybe Kampala, maybe say in Europe, or even anywhere, to come and understand the issue and maybe to lobby, to try to get solution to solve this. At times you need to locate this place. That's when you bring in the map. That's when you're able to see, I've put in a map there. These are the sub-counties showing the what? The sub-counties in Namaigo. So where actually this Banda is. Now, from this map, after you understanding basically that this is the location and this is where the issue is, not only it's Banda that has the highest, the high teenage pregnancy. We have others like this sub-county that has 26, Bukana. But that one for now, it's not a priority. First, want to address the top one. So from the top one, we shall cascade it down. Now that we have identified the district that has the highest number of teenage pregnancy, which sub-county is it? We are now going to what should we do? Now, As a data person, just the way I told you earlier, don't just think there. Think outside the box. What can we do? How can we cap this? What to get in this? So you need to get the root cause to the high teenage pregnancy. These are just demos, what I've put here. Okay, what's the root cause? You say it's the socioeconomic factors. What is it? Poverty. Okay. Now, if it is poverty and transactional sex, what activities happen in these places? Hmm? One of the things you will understand that when you go deeper, of course, you go and get the issues of maybe the lifestyle. Which community is this? Is it a fishing community? Yes, if it's a fishing community, you know those activities. So you go beyond what is there. So root cause analysis helps you to understand what exactly is happening. But how did you reach here? It is the data. So that's how important data is. If you use data correctly, you can save community more than even the medication. Because this one will tell you this is where the issue is. You go deeper and deeper. Now, for example, Namaigo, these are the activities. Now we're able to see we have poverty is there, early marriage is there, then there's high dropout rates. Basically, you'll know that these are the key contributors. Now, after you understanding this, you also, you know what, you suggest, you think outside the box, you suggest some, some few activities for these people, or to cover this. Now, this follows under the strategies to reduce all teenage pregnancy.